Well, there are air quality advisories in effect in large parts of British Columbia because of wildfire smoke. I want to bring in Michael Mehta. He is an environmental studies professor at Thompson Rivers University in Kamloops. He joins me now to talk more about this. Michael, just how bad is the air quality right now in northern BC?
So hi, Natalie. It's pretty extreme. We have levels in northern BC in particular that are about 40 times higher than what the World Health Organization recommends. And those levels have been high in several of the northern cities and towns for week after week. And we're starting to see it cascade across Canada.
And now what we are also seeing is perhaps some effects, some fallout of all of this. We understand the BC Coroner's Service is investigating the death of a 9-year-old boy in the community of 100 Mile House. That's about just shy of 200 kilometers north of where you are right now in Kamloops. His parents say his asthma was made worse by wildfire smoke. This is very early in the investigation, but I'm wondering if you know if there are any precedents where air pollution was deemed a direct cause of death or at least a contributing factor.
Yeah, that's tragic. And we know that probably about 10 million people per year die as a result of exposure to air pollution. There has been a couple of groundbreaking cases. The most notable one was about a decade or so ago in London, England, where a young girl was actually definitively defined as passing away as a result of air pollution exposure, which magnified her asthma. So we're starting to understand a lot more about this. It's more, obviously, the effects are more pronounced in older adults with strokes and heart attacks and things like that. But this is, as just the tip of the iceberg. And
we will, of course, continue to watch that as that investigation with the BC's Coroner's Office gets underway. As we said, it's just very early stages in that investigation. I do want to talk to you, though, about sort of the trickle-down effect, the domino effect here between wildfire smoke and different things happening in the province. I'm wondering, what about the relationship? Is there? What relationships, perhaps, is there between wildfire smoke and the drought that BC is currently experiencing?
Well, the drought itself has been a consequence of many years of inadequate precipitation, driven primarily by climate change. And this year in particular, as we move through a very powerful El Nino cycle, coming up to probably most extreme in the winter, we are seeing a drying of a lot of the land, a lot of the fuel, as we call it, the forest and the grass, of course, are getting very dry. And that just makes them a lot more susceptible to human-caused fires and lightning and things like that. So we have right now in British Columbia close to 400 wildfires running around the province, several of them not too far from my city of Kamloops as well.
And we are 4 weeks into summer, so I'm wondering how you find and how you think this season compares to others.
Yeah, it's earlier for sure. 2017 was also a really bad year. In the interior, we had a good 6 or 7 weeks of very high levels of smoke and a lot of wildfire activity around us. And that was also coinciding with an El Nino year. So there is a link here. 2021 was bad, but not as bad as this year. I expect next year to actually be a lot worse because this El Nino cycle will magnify itself over the winter months, and it'll continue to dry out all the forests and everything else. So, we're nowhere near out of this year.
So, Michael, given that, what can people do to keep themselves safe right now?
Well, there's barrier approaches. For example, staying indoors is pretty critical, but you have to condition or treat your indoor air quality. And the basic way to do this is with a HEPA filter system. I have a few in my house, and they're able to keep the air pollution indoors at about 1% of what it is outdoors. So that's a bare minimum. I think if you are going outside and the levels are high like that, it would really benefit you to wear a respirator mask that will reduce some of the exposure. And of course, just basic things like consuming lots of water will help you flush a lot of those particles from the pollution out of your body.
So what, though, Michael, about the long term? What do you think people, particularly in British Columbia, but generally across Canada, what really should people be advocating for at this point?
It's a tricky one because we're already really stressed, like a lot of provinces, in terms of our healthcare resources. We know that wildfire smoke is causing a lot of economic loss. In the States, it's been estimated at about $100 billion a year of loss from wildfire smoke exposure. In Canada, it's probably in excess of $10 billion. And of course, unfortunately, a lot of these events happen during the summer months when a lot of hospital staff are on vacation. So it's a perfect storm in many respects. We probably need to advocate a lot more for better quality risk communication. People simply don't understand what they're exposing themselves to.
All right, we will have to leave it there for today. Michael Mehta in Kamloops, BC. He is an environmental studies professor at the Thompson Rivers University in Kamloops.